Hello and welcome. I'm Dr. Rose Kavari. As a urologist specializing in functional and reconstructive urology and a professor of men's health at the University of Texas Medical Branch, I've dedicated my career to the well-being of men. A core part of my philosophy is that no health topic should be off-limits or a source of embarrassment. Open, honest communication is the first step toward a healthier, more confident life. Throughout my years in practice, I've had the privilege of speaking with thousands of gentlemen, especially those who are navigating the changes that come after 60. And one topic that comes up more often than you might think, though, usually in quiet tones, is personal comfort and skin health in our most private areas. Today, I want to bring this conversation into the open and talk about a very important but often overlooked subject, the topic of men's personal skin health. More specifically, I've noticed a significant amount of discussion online recently about using natural products, and one name keeps appearing: castor oil. You might see claims about it being a miracle cure or a secret remedy. As a medical professional, my goal today is to cut through that noise. I feel it's my responsibility to provide you with a clear, balanced perspective, one that is firmly grounded in science and, above all else, prioritizes your safety. Before we dive in, please allow me to make a crucial point. This video is for educational and informational purposes only. It is designed to empower you with knowledge, but it is not a substitute for a direct one-on-one consultation with your own doctor. Your physician knows your health history and is the only person qualified to give you medical advice. If you are experiencing any concerning symptoms whatsoever, such as pain, persistent itching, swelling sores, a rash, or any changes in function, please make an appointment to see your physician for a proper diagnosis and treatment. Let's begin. Understanding your skin. Why this area is different. So first, let's explore why skin care in this particular area deserves special attention, especially as we get older. The skin is our body's largest organ, but it's not uniform. The skin on the soles of your feet is tough and thick. The skin under your eyes is thin and delicate. The skin in the genital area is unique as well. It is naturally thinner and more delicate than skin on most other parts of your body. It has a thinner outer protective layer and is rich in nerve endings, which makes it highly sensitive. Just like the rest of our body, this skin goes through the natural aging process. Over the decades, our body's production of collagen and elastin, the two key proteins that act like scaffolding to keep our skin firm and flexible, begins to decline. As a result, skin everywhere becomes less elastic and thinner. Furthermore, our skin's ability to produce its own natural oils, which form a protective moisturizing barrier, also diminishes. For the already thin and delicate skin in the genital area, these changes are often more noticeable. This can lead to issues like dryness, a feeling of tightness, chafing, or itching from simple friction against clothing. While this type of simple dryness or xerosis isn't usually a dangerous medical problem, its impact shouldn't be underestimated. It can cause significant daily discomfort, create anxiety, and certainly affect your self-confidence, including in moments of intimacy. Feeling comfortable in your own skin is fundamental to your overall well-being. Now it is absolutely crucial that we learn to distinguish between simple dryness and other medical conditions that require a doctor's care. There are several dermatological conditions that can affect this area and mimic the symptoms of dryness. For instance, your doctor would look for signs of balanitis, which is an inflammation of the head of the penis, often caused by infection or poor hygiene. They might also check for fungal or yeast infections, which can cause an itchy red rash. Other conditions like psoriasis, an autoimmune disorder that causes skin cells to build up and form scaly itchy patches, or lichen sclerosis, a less common condition that causes white patchy skin that can be fragile and prone to tearing, require specific medical treatments. The key takeaway here is that not all itching or redness is just dry skin. That's why I will always stress, when in doubt, get it checked out by a professional. A scientific look at castor oil hype versus reality. All right, let's turn our attention to the product at the center of this discussion, castor oil. Its use isn't new. In fact, it has a history stretching back thousands of years to ancient civilizations like Egypt, where it was used for everything from lamp fuel to a health remedy. But as a modern scientist, I'm interested in what the evidence tells us today. Castor oil is a vegetable oil pressed from the seeds of the Ricinus communis plant. Its chemical makeup is what makes it so unique. About 90% of the oil consists of a special fatty acid called ricinoleic acid. This compound is responsible for most of the properties we're about to discuss. Based on dermatological research, here is what we know castor oil can do for skin in general. First, it's an excellent moisturizer. It actually works in two ways. It acts as a humectant, meaning it can draw moisture from the deeper layers of the skin and even the air into the top layer of skin. It also acts as an emollient, meaning it forms a soothing oily layer on the surface that seals that moisture in preventing it from evaporating. This dual action makes it very effective for combating general dry skin on places like your hands, elbows, or feet. Second, it has demonstrated anti-inflammatory properties. Several laboratory and animal studies have shown that when ricinoleic acid is applied to the skin, it can help reduce inflammation and has a pain-reducing effect similar to some topical treatments. In theory, this property could be beneficial for calming down minor non-infectious skin irritation. And third, it supports the skin's natural barrier. A healthy skin barrier is like a well-built brick wall protecting you from environmental irritants and preventing water loss. The fats or lipids in castor oil can help fill in the mortar between the bricks of your skin cells, reinforcing this barrier and making your skin more resilient. However, and I cannot stress this point enough, this is the most critical takeaway from this section. While these properties are promising, they have been studied for general dermatological use. As of today, there are no large-scale, peer-reviewed clinical studies in humans that specifically evaluate the safety and long-term effectiveness of applying castor oil directly to sensitive genital skin for the purpose of healing any condition. The scientific method is rigorous for a reason. It helps us separate what works from what might be a placebo or simply a coincidence. The claims you read online are almost entirely based on personal anecdotes, individual stories, not on controlled scientific evidence. And relying on anecdotal evidence for health decisions can be misleading and potentially unsafe. A urologist's guide to safe application. If you choose to proceed. As a physician, my first and primary recommendation will always be to use products specifically designed and tested for sensitive skin moisturizers that are dermatologically tested, hypoallergenic, and free of fragrances and dyes. However, I am also a realist. I understand the desire to use natural products. If, and only if you have already consulted with your doctor, they have ruled out any underlying medical conditions, and they have confirmed you are only dealing with simple dryness, then you might still consider trying castor oil. If you make that choice, it is imperative that you do it in the safest way possible. Let's walk through that process step by step. Step 1. Choose your product meticulously. Quality is everything here. Do not just grab the first bottle you see. You must look for oil that is labeled 100% pure, cold-pressed, and hexane-free. Let me quickly explain what that means. Cold-pressed means the oil was extracted without using high heat, which helps preserve its beneficial nutrients. Hexane-free is even more important. Hexane is an industrial solvent that is sometimes used to extract more oil from the seeds. You do not want any residue of an industrial solvent anywhere near sensitive skin. An organic product is an excellent added assurance of purity. Step 2. Perform a patch test. This step is absolutely non-negotiable and is the single most important safety check. Before you apply the oil to its intended area, test it on a small, less sensitive patch of skin. The inside of your forearm is a perfect spot. Apply a single drop of the oil, cover it with a small bandage, and leave it for a full 24 to 48 hours. Then check for any signs of reaction redness, a rash, hives, bumps, or itching. If you experience any irritation at all, no matter how mild your body is telling you this product isn't right for you, wash it off and do not use it. This 5-minute step can save you days of potential discomfort. Step 3. Cleanliness is paramount. Always begin with clean hands. Then gently wash the genital area with warm water and a mild, fragrance-free cleanser. Rinse thoroughly and pat the area completely dry with a fresh, soft towel. Applying oil to damp or unclean skin can trap moisture or bacteria, which could lead to irritation or infection. Step 4. Use a minimalist approach. With a thick oil like castor oil, less is truly more. You need a very small amount, literally 1 or 2 drops is sufficient. Put it on your fingertip, rub it gently between 2 fingers to warm it slightly, and then apply a very thin, even layer over the dry skin. The goal is a light sheen, not a greasy coating. Do not rub aggressively, as this can cause friction and irritation. Step 5. Consider timing and frequency. The best time for application is typically at night before you go to bed. This gives the oil several undisturbed hours to absorb into the skin. To avoid staining, you might consider wearing a pair of loose-fitting, breathable cotton underwear. Start with a low frequency, perhaps just twice a week. See how your skin responds over a couple of weeks before considering applying it more often. Step 6. Listen to your body and be your own advocate. Pay close attention to how your skin feels. Is the dryness improving? Is there any new discomfort? If you feel any irritation, or if the dryness does not show any signs of improvement after a couple of weeks, stop using it. Your body is your best guide. And remember, do not try to self-treat a problem that isn't getting better. That's a signal that it's time to check back in with your doctor. Finally, a crucial point. Never apply castor oil to broken, inflamed, or infected skin. If you have any cuts, sores, or a rash, applying oil can trap bacteria and make the problem much worse. The oil is for moisturizing dry, intact skin only. The big picture pillars of true health and vitality. Now I want to zoom out for a moment because it's so important to see the whole picture. Focusing on a single product or a single body part can make us miss the forest for the trees. Healthy skin is an inside job. It is a reflection of your overall health. Applying any oil is merely a supportive measure. It cannot replace the solid foundations of good health. To feel truly healthy, vital, and confident at this age, we need to tend to the pillars that support our entire well-being. First, cardiovascular health. This is pillar number 1. Your circulatory system is like a network of highways that delivers oxygen and vital nutrients to every single cell in your body, including your skin and erectile tissues. Good blood flow is essential for healthy function. The best things you can do for your circulation are to eat a heart-healthy diet, get regular moderate exercise, and if you smoke, seek help to quit. Second, proactive nutrition. What you eat directly translates into the health of your tissues. Focus on a diet rich in a variety of colorful vegetables and fruits, which are packed with antioxidants that fight cellular damage. Include lean proteins for tissue repair and healthy fats from sources like avocados, nuts, and olive oil. Omega-3 fatty acids found in fatty fish like salmon are particularly good for reducing inflammation. And don't forget hydration. Drinking enough water throughout the day is one of the simplest and most effective things you can do for your skin health. Third, consistent physical activity. Movement is life. Regular exercise like brisk walking, swimming, cycling, or light strength training does wonders. It strengthens your heart, improves circulation, helps maintain a healthy weight, reduces stress, and boosts your mood. Exercise can even help your body produce more nitric oxide, a molecule that helps relax blood vessels and improve blood flow. Gentle exercises like pelvic floor exercises, also known as Kegels, can also be beneficial for supporting pelvic health. And fourth, stress management and sleep. We often underestimate the physical impact of chronic stress. Stress releases a hormone called cortisol, which over time can negatively affect libido and overall health. Finding healthy ways to manage stress, Whether it's through a hobby meditation, spending time in nature, or talking with friends is crucial. And quality sleep is when your body does most of its repair work. Aiming for 7 to 8 hours of restful sleep per night is not a luxury, it's a vital component of good health. Your sexual health and personal comfort are often sensitive indicators of your overall health. Think of them as the check engine light for your body. When they're off, it's often a sign that a larger system needs attention. Conclusion and final words of encouragement. So to bring it all together today, castor oil is a natural product with scientifically recognized moisturizing and anti-inflammatory properties that can be beneficial for general dry skin. However, it is not a medically proven miracle cure for any condition related to genital health. Using it on this delicate skin, if you choose to do so after consulting a doctor, must be done with the utmost caution and awareness. The most important message I hope you take away from our conversation today is not about a specific oil, but about the power of being proactive. Be proactive in learning about your incredible body. Be proactive in nourishing yourself with a holistic lifestyle. And most importantly, be proactive in having open, honest conversations with health professionals. We are your partners in health, and we are here to help you navigate every stage of life with dignity and confidence. Thank you so much for your time and your attention today. Take good care of yourselves because your health is and always will be your most valuable asset. Goodbye for now.